Hey everybody, my name is Jake Burdett. Thank you for watching another video. Please subscribe if you are already not subscribed. I hope everybody had a happy New Year's and is looking forward to a good 2019. My personal New Year's resolution is I want to make YouTube videos on a more consistent basis. Ideally every day, new video every day, but I'm almost positive I'm not going to stick to that. Probably won't even stick to it tomorrow, but fuck it, I'm going to say it anyways, and hopefully it becomes reality. But yeah, so today I want to talk about the healthcare debate and specifically advocate for why we should have a Medicare for all system in the US, meaning that the government would provide healthcare as a human right and not just a privilege to people who have the money to afford to buy insurance from a private corporation, because that's the way that we currently do it here in the US. Is in other countries, the government does provide health care as a right to all citizens that is funded through taxes. So in other countries, just by being a citizen, you automatically have health care and it's free. You just, when you get hurt, you go to the doctor, you get treatment, they don't charge you anything because you've already paid for it through taxes. But here in the US, the government does not provide health insurance, so Americans don't, our tax money does not go to insurance, and instead the default is you don't have insurance, and if you want insurance you have to go out on the private market and buy it through a private corporation or some sort of health insurance industry that is for profit. Conservatives like to argue that the private market is the place to solve all problems, that competition will produce better outcomes and cheaper outcomes. And for some products that is true, but for the product, and we're calling healthcare a product. It's not really a product, and that's exactly the problem. Is a product is something like a pen. Healthcare, on the other hand, is a necessity, and there's a really big difference between the two. So capitalism might provide better outcomes and cheaper outcomes for something like selling pens, something that people don't need. Because with the pen, let's say, for example, a pen company, this is just a normal standard pen. Let's say a pen company walked up to you and said, hey, will you buy this pen for $50? You would tell that pen salesman to fuck off because you know that this pen is not worth $50. And you have the freedom to tell them to fuck off because you don't need this pen. If you don't buy that pen today, you'll just go about walking on like with the rest of your day like nothing happened, and you'll be completely fine. And the pen salesman knows this, so they can't charge $50 because then they wouldn't make any money because the pen's not worth $50 and no one would buy their product. So the pen owner would be forced to move his price down to maybe $2. Someone might pay $2 for this pen. Conservatives will call that the invisible hand of the market. And yeah, sure, that might work to a degree for something like a pen that people don't need for the reasons I just explained. But for something like healthcare, let's do the same thought exercise. So let's say you have cancer and you need pills to treat your cancer, or you're gonna die, and you go to the doctors and the doctor says, hey, your insurance wants $50,000 for that cancer medication. So now the insurance company, which is seeking a profit, is taking the place of the pen salesman, which was also seeking to make a profit. And in the case when the pen salesman asked for a high price, you as the consumer could tell the pen salesman to fuck off because you don't need that pen. But now you as the patient with cancer who needs to purchase health insurance, you're not in a position where you can tell the insurance, fuck off, I'm not going to buy your cancer medication. that's way too expensive, $50,000. I don't have $50,000. You can't tell them that, because the alternative to not paying that money for the insurance is you just won't get your medicine and then you'll die. So with the pen, you could walk away, so they had to lower their price. But with insurance, you can't walk away because you'll die, so you have no choice but to pay the incredibly high price that the insurance company asks for. Does that make sense? So basically, because they're selling a necessity that people need to live, they can charge as high a price as they want. And that's why when you look at the prices that we pay for healthcare in America, where it is run by the private market, we pay way more per person on healthcare than they do in those countries with the single payer system where healthcare is provided as a human right. We pay far greater than they do because we're held at the mercy of for-profit health insurance companies, while in those other countries, healthcare is just free. And the argument that conservatives will make is, hey, yeah, we might have to pay a lot for private insurance here, but if we switch to that other system where it's provided through taxes, your taxes would have to raise. And they make that argument because they want to scare people into thinking that if we have Medicare for all and provide healthcare as a human right for free, then your taxes will raise and you'll have less money. But the truth is, yeah, your taxes are going to have to raise, but because we would be switching from a for-profit system where the prices are very high to a government-provided system where the prices are much lower, yeah, our taxes increase, but we also eliminate that even bigger expense on the private market that we had to pay before. So even though our taxes are being raised, we are still net saving money. For example, let's say you currently have health insurance through a health insurance company, and they charge you $1,000 a month for your health insurance. And then there was a proposal on the table to switch America from the current private insurance system where you're paying $1,000 a month for insurance to a Medicare for all system where it's provided through your taxes. But to pay for that Medicare for all, we would have to increase taxes by $500 a month. So your taxes are now being increased by $500 a month, but you no longer have to pay that $1,000 a month on the private market. So you are net saving $500. Even though your taxes are going up by $500 a month, you're saving $1,000 a month. So when you do the math, you are net saving $500. So it is possible for taxes to increase and people still save money if it eliminates a private market expense. So I know that was kind of confusing. I tried my absolute hardest to explain that in a way that's simple enough for people who really have no concept of the healthcare market or the healthcare debate. I try to keep it in layman's terms. But yeah, to summarize, so and another massive problem I forgot to mention is in the system that we have here, where the default is you don't have insurance and you have to voluntarily go out and purchase insurance from a private company, is not everyone is going to have the money to buy health insurance, and as a result, millions of people in America just don't have insurance. I think 30 million is the number. 30 million Americans do not have health insurance because it is too expensive. Meanwhile, in those other countries where it's provided as a human right to all citizens, literally everyone has health care. So to compare and contrast the different systems, here in America, not only do we pay more for our health care, but we have millions of people who don't have health care, and as a result, thousands of people die every year because they don't have health care. So you have America where we pay more for our health care, cover less people, have thousands of people die every year because they don't have health care. Meanwhile, in those other countries, they pay far less, they cover everyone, and no one dies because they don't have access to health care. Which is ridiculous to think that America is the richest country to ever exist in the history of mankind, and yet we can't even provide something as basic as health care to all of our citizens. They say we don't have the money to do it. We have the money to do it. Every other modern Western country has the single payer system that provides healthcare as a human right, and they have far less money than we do. So if they can do it, we can do it. It's a lie that we can't do it and that it's too expensive. As I've already explained, switching to the Medicare for all single payer system that provides healthcare as a human right would literally save everyone money, because it would eliminate that massive private market expense and replace it with a much smaller tax increase. So, if the cost is cheaper for a Medicare for all system and it would cover everyone, the obvious question is, why don't we move towards that system if it's so obvious? If every other country has already moved towards that system and it gives us better results, why wouldn't we do it? Well, because there is a ton of money to be made on the private health insurance market, because private health insurance companies know how desperate sick people are, and they know they can charge as high a price as they want, and sick people have no choice but to pay. And the private insurance companies take complete advantage of those people's desperation, and they price gouge the shit out of them, and they charge extremely high prices. And if we did move to a Medicare for all system, those health insurance CEOs would lose a shit ton of money, and they don't want to lose a shit ton of money, so they basically hire lobbyists and donate to elected officials. With the donations act as bribes, essentially. So they bribe politicians not to move us to a Medicare for all system, so that they can keep profiting off of the desperation of sick people. So, of course, corruption's involved with this, as corruption's involved with everything in American politics. But, yeah, so that's kind of the main points that I want to get across, is that here in America we have a for-profit system of healthcare that doesn't insure it as a human right, and we pay far more for it than any other country. We cover less people, and thousands of people a year die because of that, while in other countries they pay less for their healthcare, cover everyone, no one dies because they don't have it. So there's really no reason for us to drag our feet on this any longer. America needs to modernize and get a Medicare for all system like every other country has in the world. And it really is just barbaric that our government does not give a shit that 30,000 people a year die in the richest country to ever exist in the history of mankind because they don't have health insurance. It makes us sound like a third world nation. So yeah, those are the big points I want to get across. One last thing I want to say is, so you can have the complete free market system, which is what we kind of had under George Bush before Obama, or you can have this Medicare for all system, the single payer system that most other countries have. And there's also kind of an in-between thing. I'm sure you've heard of Obamacare or the Affordable Care Act. They're the same thing, but go by two different names. And Obamacare was sort of a middle ground. Obama tried to market Obamacare as universal health care that gave everyone coverage, but that's bullshit. It didn't give everyone coverage. What it did was Obamacare was a law that was passed saying that by law you have to buy health insurance. Before it was an option to buy health insurance, but now they're saying by law you have to buy health insurance. And if you don't buy health insurance, you get fined at the end of the year. I believe it's a $3,000 fine. So that was Obama's way of trying to say, hey, look, we have universal health care coverage because there's a law saying everyone has to buy health care, so therefore everyone has health care, right? Well, no, not right, because despite it being a law that you're supposed to buy health care, regardless of the law, if poor people don't have enough money to buy health care, they don't have enough money to buy health care, even if they want to. So what ends up happening is, even though there is a $3,000 fine for not buying health care, the cost of having health care, when you add it up at the end of the day, is actually oftentimes more than the $3,000 fine for not having health care. So even though people are supposed to buy health care, millions of people still don't have health care just simply because they can't afford it, which is why Obamacare did not go far enough. Obamacare should have instead been Medicare for all, that provides health care as a human right. But Obama had accepted a lot of donations from the healthcare industry. Obama was corrupt in many ways. That was one of them. And because he was corrupted by the healthcare insurance industries, he listened to his donors and he didn't pass Medicare for all. And now because he's corrupt and because he stabbed Americans in the back, thousands of people a year die because of a lack of health insurance, and that's Obama's fault. And because of that, because he went with the shitty compromise of Obamacare, he lost his supermajority in 2010, and he suffered for it the rest of his presidency. But that's his own fault for being corrupt. The Democrats had a supermajority from 2008 to 2010. They could have passed Medicare for all if they wanted to, but Obama did not want to because he was corrupted. So yeah, that's. I just wanted to finish it off by explaining what Obamacare is and how Obamacare is not universal coverage. Don't listen to people if they say that it is. The Affordable Care Act was better than the system we had before, because it did in many ways make insurance a little more affordable, or at least it slowed down the rate of growth of premiums every month. But it's still massively flawed because it still keeps health insurance in the hands of the private market instead of moving to a Medicare for all system. So I hope this was helpful. Maybe watch it a couple times. I know it is confusing, especially if you're new to this debate, getting a real understanding of the different healthcare systems and the pros and cons of each one. But I think I did a decent job explaining it. Please comment any feedback, and follow me on Facebook and on Twitter and all that. And comment what is your New Year's resolution, guys? I want to hear from you guys too. So thank you.